welcome once again. In the earlier video, we spoke about what basically is surgery and as a homeopath, surgery के indications क्या-क्या है, surgery का दायरा क्या-क्या है, right? हमें एज अ होम्योपैथ ये जानना बहुत ही ज्यादा जरूरी होता है कि हम सर्जरी क्यों पढ़ रहे हैं, बराबर है। बट ये तो जान लिया अभी सर्जरी क्यों जरूरी है, बट देन अपना होम्योपैथी उसका स्कोप कहाँ पे है? वेल ये भी उतना ही इम्पोर्टेंट है बिकॉज मैंने पहले वीडियो में तो आपको बोल दिया कि लगभग 70% केसेस एज अ होम्योपैथ यू कैन मैनेज विच आर गोइंग टू अ सर्जन, but then how to identify those 70% cases and who will give you those 70% cases? So now if you are in second year and third year, watch this with full attention because yahi pe aap aapka confidence rise up कर सकते हो because you will not understand कई बार कि आपके पास जो केसेस आ रहे हैं knowingly unknowingly they are surgical cases in disguise, trust me. So now as I said सर्जरी क्या है, सर्जिकल केसेस वो बेसिस पे आपको समझ में ही आ गया होगा, राइट? सो जो पैथोलॉजिकल कंडीशन मतलब पहले फंक्शनल डिरेंजमेंट होता है, फिर पैथोलॉजी बढ़ जाती है। अभी पैथोलॉजी बढ़ गई तो हम मेडिसिन लाइन ऑफ ट्रीटमेंट देते हैं, मेडिसिन इनइफेक्टिव ठहरे, अभी वो एलोपैथी बोलो या होम्योपैथी बोलो, then they go into intervention of instrumental techniques that will remove those pathological end product which has been formed, right? वहां तक we spoke. So indications of surgery हमने बताया, अभी इंडिकेशन ऑफ सर्जरी हमने बताया है, बट मैंने ये भी बता दिया कि एलोपैथिक मेडिसिन से कंपैरिजन करके होम्योपैथिक मेडिसिन का दायरा थोड़ा बड़ा है, मतलब आप काफी हद तक पैथोलॉजिकली एडवांस केसेस ट्रीट कर सकते हो। कैसे और कौन से? वेल तीन इंपॉर्टेंट कैटेगरीज है जो आपको ऑब्वियसली दिखेंगे, हम मैथमेटिकली बता सकते हैं। तीन कैटेगरीज, प्री ऑपरेटिवली, पोस्ट ऑपरेटिवली एंड इन प्लेस ऑफ सर्जरी। अभी प्री ऑपरेटिवली मतलब क्या? मतलब इफ यू आर वर्किंग इन अ बिग हॉस्पिटल सेटअप जहाँ पे ये आपका पेशेंट है हु इज पोस्टेड फॉर सर्जरी, you will be able to manage those conditions that any surgical patient experiences just before the operation. Okay. Second is in place of operation. Matlab you are managing this patient again in your OPD setup. Maybe you are attached to with a surgeon, maybe you are connected with a surgeon and you know ये pathologically बहुत advanced case है, but you're buying in time and you have been able to treat, मतलब आपने ये पैथोलॉजी को एक्चुअली ट्रीट कर दिया है with the help of your homeopathic medicine. Small cases like abscesses are wonderfully treated. Big abscesses also are equally good treated with homeopathy. So right, that will be their example in place of surgery. Now what do you mean by post operative? Post operative मतलब पोस्ट ऑपरेटिव आने वाले जो जो कॉम्प्लिकेशंस आते हैं, जो जो कंडीशंस आते हैं, इट कुड बी not taking in the implant properly, it could be breaking up of the scars, it could be bleeding, it could be nausea, vomiting, it could be post anesthesia ka effect, or it could be multiple things that the person generally patients routinely experience post surgery. So basically what are you, where are you acting now? You're acting pre-operatively, you're acting post-operatively if you have an IPD setup, right? If you're working in an institution जहाँ पे IPD setup, but you also have a good chunk of patients who will come directly to you who may not be going to the surgeon, and you also have this chunk of patients who will be treated by you, that is in place of surgery, right? So in case so you have pre-operative management, you have post-operative management and you have in place. So ये pre-operative में क्या क्या आता है? Pre-operative में कई बार आता है. Now if I have to tell you an example of this case which I treated long back in an institution with IPD setup where I was working initially, the patient came with severe abdominal pain. He was diagnosed by the surgeon as a patient with umbilical hernia with intestinal obstruction, and surgeon, I mean, he was diagnosed by the surgeon. So surgeon को आने के लिए वक्त था. So by the time we had started managing with homeopathic medicine, because the patient was here basically for homeopathic intervention only. But then we also knew हमारा scope क्या है, जो बहुत limited था. having diagnosed it as hernia, having diagnosed it as intestinal obstruction, it also became a thing for us कि like इसे manage करे भी तो कैसे करे and operation के लिए fit भी कैसे लेके जाए. But then with homeopathic medicine, within 6 hours, the patient had a marked reduction in the abdominal curve. उसका जो नौशिया वॉमिटिंग था वो सेटल हो गया था, उसका बॉबल मूवमेंट्स भी इम्प्रूव हो गया था. बट बिकॉज देयर वाज अ मैकेनिकल फ्लॉ, अम्बिलिकल हर्निया होना ही था, तो इसीलिए उसकी हर्नियोप्लास्टी हुई. एंड पोस्ट दैट आल्सो he was in very minimal painkillers, and the scar healed well. He started eating well, responding properly, bowel movements all good, and he was discharged all fine. So कहने का मतलब pre-operatively also this patient was managed, and post-operatively also this patient was managed. So basically, you can manage it pre-operatively, post-operatively. Now, in place of surgery, how? In place of surgery, के लिए a very unique case which I had was a case of septic arthritis. Now, this case was managed by the surgeons, and this case failed to respond to corrective surgeries also. He had multiple fractures, bilateral lower limb. Okay, so now these fractures were not healing well in one leg, in the left leg, the fractures were not healing well. So the wound was not healing well, and it had developed sinuses. 4 to 5 sinuses had developed. So now, because this wound wasn't healing and the sinuses were there, the limb was not operational and the patient couldn't be driving comfortably. So basically, he was on wheelchair only. Then this case was referred to me by an orthopedic surgeon. We managed this case with homeopathy only, wherein in place of surgery, right? So this sequestrum, the dead bone which was there in the wound, or in the which was already formed over there, was eventually removed after मतलब 3-4 जो sinuses थे वो heal होने के बाद जो last sinus बचा था उसमें से 2-3 sequestrum easily अपने आप निकले. वो निकलने के बाद वो भी sequestrum heal हो गया. उसके बाद में reconstruction surgery हो गई, corrective surgery, and then he got back to his work comfortably. So that was in place of surgery. मतलब उसका amputation was prevented out over here, which was ideally planned for. मतलब मुझे कुछ time दिया गया था कि we plan for a amputation if the homeopathy doesn't work. Luckily, homeopathy worked, and so yes, there you have the scope. That is what I'm telling you. Pre-operatively, in place of surgery, and post-operatively, you have the scope. So, but how are you going to define the scope? You cannot say every case is there in front of you and you're going to be able to manage this impeccably with homeopathy. No, there are certain criterias which I have understood over a period of time, and I stay by them. So even if I don't know the diagnosis, कई बार ऐसे होता है ना, out of the textbook diagnosis आ जाता है अपने पास. So मतलब optional हम वो कई बार पढ़ते नहीं है. At least this happened with me when I was a new physician, practicing physician. कई सारी चीजें ऐसे हो जाती थी जो मैंने पहली बार देखी थी, पहली बार ट्रीट कर रही थी, होता है. So but I have stuck to this thing. So now what? So in cases, though they are degenerative and even if they are pathologically advanced and often termed as irreversible and gross, we can treat it. We have scope. Why do we have scope and when do we have scope? We have scope provided there are good number of PQRS symptoms, there are good number of concomitants, or at least there are concomitants, because the more the concomitants, the less is the disease. क्या बोलते हैं ना, मतलब the more is the disease का chance to be managed by homeopathy, and if all the organs of elimination are functioning normally, so that when you give medicine there shouldn't be any kind of killer's aggravation, right? So all the organs of elimination मतलब तुम्हारा kidneys, GI, your skin, the lungs, the mouth, the breath, everything is functioning normal. ये criterias अगर है, अगर good PQRS symptoms and concomitants मिल रहे हैं, तो pathological irreversible भी case होना, take it from me that you will be able to manage it. If you're not able to manage it, that is apna, as a homeopath, that would be my shortcoming. However, homeopathy doesn't fail. it might be treated by some other homeopath. So that is how, and that is why I say that we have a good scope of homeopathy in many of the pathological conditions, right? So I hope you are able to understand and pep up with your confidence that yes, now you will be able to treat pathological advanced cases also, right? So पैथोलॉजिकल एडवांस केसेस को ट्रीट करने के लिए हमें सिर्फ दो तीन चीजें देखना जरूरी है अगर केस टेकिंग बराबर से लिया हो। अक्सर केस टेकिंग जब बराबर नहीं होता है ना, तब हम कहते हैं कि यार इसमें कोई पीक्यूआर सिम्टम नहीं मिल रहा है, इसमें कोई कंकॉम्पिटेंट नहीं मिल रहा है। तो यस, वर्क ऑन योर केस टेकिंग बिकॉज योर क्या वो एक कहावत है ना, full case taken is half the work done. So you take your full case, and once you have taken the full case, you will know that आधी लड़ाई तो वहीं पे आपने जीत ली है, बिकॉज आपको कंकॉम्पिटेंट मिल जाएंगे, आपको पीक्यूआरएस मिल जाएंगे, तो रेमेडी तो ऐसे ही सामने आएगी। मतलब देन इज द क्वेश्चन ऑफ पोटेंसी एंड रिपिटेशंस, वो अलग है, ठीक है, दैट यू विल स्पीक और दैट यू विल डिसाइड ऑन योर ओन पर्सनल एक्सपर्टीज। बट नाउ एज अ स्टूडेंट व्हाट यू नीड टू रिमेंबर इज, यस, अगर आपको क्वेश्चन पूछा जाता है कि व्हाट इज द स्कोप ऑफ होम्योपैथी इन ऑस्टियोआर्थराइटिस, you will have this again depending upon the grade, depending upon uske presence of PQRS symptom, depending upon the organs of elimination which are functioning normally or not, you have your scope, right? So that is what you're going to speak about. So वैसे ही शॉक में भी क्या स्कोप है, आपको गैंग्रीन में क्या स्कोप है, आपको any pathological condition, and you have to talk about your scope like this only. Do you get what I'm trying to say? आई होप इससे काफी हद तक आपको एक कॉन्फिडेंस में बूस्ट अप मिल गया हो। आई होप दिस हैज हेल्प्ड यू क्लियर अप योर डाउट्स अबाउट व्हाट होम्योपैथी इज इन पैथोलॉजिकल केसेस एंड व्हाट सर्जरी मींस। आई होप आई एम एबल टू at least answer your queries that you were having. Okay, so now if you really have your queries sorted out, if you really feel that you are able to understand what is the indication of surgery and what is the scope of homeopathy, what is it that you can do? You can go down, click the like button, you can comment below what you have understood, and if you really want the notes or the write up on what is the indication of surgery and the scope of homeopathy, go down, click on the link that you have that will lead you to an app where you have access to free notes, some of the free notes that I'm going to be providing. So hurry up and let me know what is it that you're understanding through this, right? See you soon.